Hi, I'm Sarah. Welcome to Sarah Appreciates if you're new here. And if you're not new here, thanks for coming back. So, uh, today I kind of wanted to talk about what maybe they don't tell you before you start chemotherapy. I have stage 4 breast cancer. Or metastatic breast cancer. Stage 4 and metastatic are kind of the same. It just means that your cancer has metastasized throughout your body. So I have Mets. I have my original tumor is was about almost in the pit of my arm, and then it moved to my lungs, and now it's in my bone. I have some bone mets as well, but otherwise I feel pretty good. I take Ibrance, but Ibrance is the brand name of the chemotherapy that I'm on. It's an oral chemotherapy, and it's a gentle kind of chemotherapy. So I still have my hair, but my nails went to crap, and my hair I've had to take special care of to keep it. So I wanted to give you some tips. I feel like they should hand out a brochure when people are diagnosed with cancer and realize that they have to go on chemo. First of all, the reason for this is I also take Lupron. I get Lupron injections monthly. And then I also get, I take Letrozole every day. So that means you might, if you have what I have, which is hormone receptor HR negative, is kind of bad news, because then you don't really respond well to hormone treatment. But mine is HR, so hormone receptor positive, which means I fortunately get a benefit from hormone therapy, which means if this is you, if this is something you have to go through, get yourself one of these. This is an ice pack that I keep in the freezer. And if you have a hot flash, this will nip it in the bud. Gone. So it fixes a hot flash probably in about 3 seconds once I put it on. Sometimes I put this part underneath back here. It feels better. Sometimes on my neck or in the back of my head. But also sometimes it works up here. I almost never wear it to sleep because, it's just going to melt. So, number 2 is bathing. Throw out unless you've got other adults in the household, you don't need adult body wash anymore, really. You can just use baby wash. In fact, No Tears baby wash with baby shampoo, that's going to be nice, because sometimes you get a little bit sore on the top of your scalp. It can just feel really sore, and that's when you know your hair follicles are kind of, I don't know, I don't want to say loose. I don't want to misstate myself, but I have talked to the specialist oncology pharmacist about this. And he's like, "You're using adult products on your hair, aren't you?" And I'm, yeah, why? So switch to a baby shampoo. He said, typically with cosmetics like makeup or hair mousse or hairspray, don't use anything you wouldn't use on a newborn while you're on chemo. So whether your chemotherapy is going to be only for a few weeks or for the rest of your life, you need to know that while you're on chemo, you want to treat your skin and your hair like you're a newborn baby. Now I've been warned about my nails too, and I have some diabetes issues. So my nails got really roughed up after I started chemo. So one of the things I do is, if you follow my nail vlog, I've been doing builder gel on my nails, but I have to be very careful to try not to touch the skin around the nails, because, now, forgive my nails, I'm between manicures. I was in the process of removing my other manicure, but I just wanted to stop and tell you that if you encounter issues with your nails like I have, the advice I got from the pharmacist was, if you feel like you have to, go ahead, but really try not to touch your skin with any of those toxic chemicals. And even pushing back your cuticle, be really gentle, because even that can scrape your nail plate if you have real delicate nail plates like I do. So that's kind of nice. Also, these like loofah sponges that you might use to bathe yourself, toss those. Get a washcloth for newborns. And your skin will be smoother because you don't need to slough off your skin. You know, people not on chemo, you get a buildup of dead skin cells. But if you're on chemo, you can slough off your healthy natural skin. So if you want to do that, maybe just bring some salt into the shower, and you can use the granules really gently here. Salt can leave your skin kind of smooth too. So after looking into, and baby lotion instead of your expensive adult lotions, just go back to basics with like your baby lotions, as well as baby sunscreen. You want to avoid all the parabens and all that kind of stuff. So just make sure that if you're using sunscreen, that you're getting something, because most chemotherapy is going to leave you a little bit sensitive to the sun. So you're going to want your SPF clothing, and you're going to want your SPF sunscreen. So you want your 50 SPF or whatever. You want to get the kind that you would put on a baby. So just go right for the kids aisles. That's the same thing with your hair combs and your hair brushes. Go back to like goat hair brushes. Don't pull. I used to, when I was in the shower, take, now see, I'm pulling out hair. I don't know if you can see all this hair, but I've had to kind of reduce the amount of combing I do, because I've been shedding. So they recommend about 1 to 2 hair washings a week. You don't need to bathe every day. Maybe if you want to take a shower, maybe once a week. But in between, I use baby wipes. And I used to do this for camping, but now it's more of that's sort of an everyday thing. And then I shower like 2 times a week or so, give or take. Like typically like once a week, because we have kind of hard water. So then if you're going to use makeup, they say to use only the most gentle. I wasn't really able to get any brands out of her, but the pharmacist said to use just the most gentle kinds of makeup. Skip the foundation if you can. Skip anything with like mega oops, latza, like super mega long lash kind of things. Waterproof mascara is not, that might have more chemicals than regular mascara. So I don't know much about makeup. I'm not a big makeup girl. But just so that you're aware, again, I'm just drinking water. That's just water. If you're a big makeup kind of person, look into, well, she said organic brands, but I know organic is kind of a tricky thing too, because I've learned that about food. Not everything organic is healthy. So what you want are things you can pronounce, in the labels. Really simple things. I'm not here to put any like big, I'm not marketing a brand or anything like that. I'm just telling you like what I've been told. Like if you oil your legs or put oil on after your showers, go back to basics, go to the baby oils. Like don't do a lot of fragrances that they don't even, they were even like Will Perfume, hairspray, mousse, because I was looking into mousse to see if I could get a little bit more lift in my hair. No mousse. Stay away from mousse. Stay away from, like I said, anything you wouldn't put on your baby, like your newborn, essentially. And so then with nail polish, that's a risk I'm taking. I'm not recommending this to anybody. So if you do your own nails, that's different. But I don't go to the salon where they'll, shave down half your natural nail and then put on your fake nails. I give my own nails a very light buff, barely even, because they're already rough enough to take the bond anyways. They also recommended soft, because you might get itchy, dry skin. And if that happens, vitamin E in the baby, baby oil with vitamin E, stuff like that. But also just softer fabrics that you want to wear. That's a good tip. I wish somebody had kind of told me a little bit more about all of this. And then also, if you're starting chemo, the more you get, because like I am just getting off of week 3, so today I'm still kind of tired. Yesterday I slept almost all day. That's pretty normal, but if you don't notice yourself perking up during your week off of chemo or whatever your chemo, at the end of your chemo cycle, if you don't start perking up after that, talk to your doctor about getting a vitamin B complex, like checking your blood for vitamin B, and also vitamin D. They found my vitamin D was incredibly low because I wasn't bouncing back. So they gave me quite a high dose of vitamin D that I take daily now. But I just wanted to recommend that because if you're not bouncing back from your chemo cycles, and that's another thing they don't really tell you, they don't warn you ahead of time to tell them. But just let your doctor know that you're not bouncing back, you're still really, really tired all the time, and maybe they can check your vitamin D levels or your vitamin B levels and give you a little supplement to help you get that, because we're sensitive to sun, so we're always blocking the sun, so we might not be getting our vitamin D like other people do from the sun. So that's real normal, and don't be afraid to ask your doctor about that too. So these are just a few of the things that I kind of thought of to maybe help people kind of adjust to this whole new lifestyle of going on chemotherapy, because it can be kind of a lot, even if you're just on gentle chemotherapy. I know there are rougher chemotherapies that can cause sores in the mouth and all kinds of other things, for which I've also heard like pulling with oil, like pulling with like coconut oil. There are tutorials online on how to do that too. So if you're noticing some sores in your mouth or getting really sore when you're brushing your teeth, they also recommended a toddler toothbrush, like a toothbrush for when you're teaching kids with the really soft bristles. They almost feel like a bristle for like a hairbrush. They're really soft. And yeah, because my gum started bleeding. So just like a toddler toothbrush is fine. If you feel like your mouth is still really sore, you can try a toothbrush like made for kids, a toothbrush without fluoride. That might be a little less abrasive in your, but don't go for like the tooth whitening stuff and all of that other crap. Just the most basic toothpaste you can find. You shouldn't need, don't worry about the tartar buildup and stuff like that, because those are just extra chemicals you're putting in your body that can be rough on your mouth a little bit if your mouth is really fat, if your mouth is sensitive right now. So other things for sensitive skin, wash your face with water and your hands, or again, just use that newborn, like a washcloth for newborns. I would check them out on like Amazon. They're not too expensive. And your bath towels that you would use for like a newborn. So buy yourself a little set of bath towels and rotate those around for your baths. But typically I bathe with a lot of like baby wipes and so forth. So, or take a lot of like what you might call like a tub bath, like in the sink, just washing my whole body, but not messing with my scalp too much, because the top of my scalp gets really sore if I wash my hair too often. And again, that could have to do with like the adult shampoo and conditioner that I've been using, but since then I've switched to the baby shampoos and I haven't had as much scalp aching as much, so that's really helped. So anyways, if you have any questions, feel free to leave them in the comments below. If you have any suggestions also, or anything that you think I've left out, please feel free to leave them again in the comments below. And if you like my content, please feel free to like, share, and subscribe. Have a great day, and please be kind to yourself and others. Bye.